this COVID crisis, initially, again, riddled with anxiety. I thought, oh my gosh, I have one kidney. My kidney functions lower than everybody else. There's renal failure in this disease. Oh my gosh, here we go again. And again, what can I control? The environment around me. We had a talk with my family. They're aware I have a 21-year-old and I have a 17-year-old. And my husband, and we all sat down, and knowing the importance of washing our hands and wearing scarves or masks or whatever we had here at home if you're going to go out, and doing our best to try to keep this out of the home. And it is an extra layer. The day that it was March 17th, the day I got my last CAT scan, the hospital closed for all unnecessary CAT scans that day. And I looked on Instagram, and there are some people who are struggling with not even being able to have surgery during this time. This is a very stressful time. It is unprecedented, and my heart goes out to them, because, I mean, how fortunate were we if looking at what we can be grateful for during these times? If we're getting our surgeries, if we're getting our treatment, we should be. And there was just a small period where things were getting rescheduled as far as what I can see. And surgeries are now coming back on slowly and scheduling for May. But it's just an added layer of stress for us cancer survivors who, what if I go in the hospital? I have a picture of myself, what I look like going in the hospital, gloves, mask. I could share it with you. But, you know, we laugh, but it really is this era now. Life is different, and adapting to it without panic, and hoping that our family understand, I don't know, other people's scenarios, but for me, it was important that the entire family understood, and they do, and they understand that it does affect us differently, especially those of us on immunotherapy. I am not on it myself, but I have friends who are, and you have to be extremely cautious. And as if, when chemo patients come into the hospital with masks and staying clear of even the smallest virus, the smallest pathogen, and we just have to behave like that for now. And that's okay. It's difficult, even trying to keep our health, trying to eat well during this time. I found, and I'm not sure for you guys, but the grocery stores are different. I go in and I try to get some nice, vegetables or fruits, and half of the stuff isn't there, and we have to make do. And it's easy for our brains to go and panic. I feel that during this time, it's extremely important that we reach out to our friends via Skype or via whatever, FaceTime. Share with the people that are closest to us mentally how we feel, the stress. It's not to make it sound like victimhood, but for us cancer survivors, it is a little more stressful, and it should be. And we should be careful and watch for ourselves a little bit more than someone who's got 2 kidneys and a able body or not in immunotherapy. And it's important that the people around us who love us understand that, and that they handle any precaution seriously. And we're going to get through this. Us cancer survivors, we get through it. We'll be good. And we have to also be mindful that this is also going to pass. This isn't forever. And if we have to adapt our new way or going out, or we'll just slowly have to see what's happening. Every week, something's different. And for me, I like to do things a little bit socially with friends, working out or going out. And we've just been seeing each other on like everyone else is doing. And I've been trying to work out in my home. I've got some dumbbells now, care of Amazon, and doing what I can here at home to try to stay healthy. And I'm not going to give up on that just because of this pandemic. Health is most important, as it should for us cancer survivors.